Hello and welcome to the donning and doffing personal protective equipment or PPE for COVID-19. By the end of this session, you should be able to understand the indications of wearing PPE, know the basic PPE required for donning, know what needs to be prepared before donning and doffing, understand the steps to this skill, and finally, troubleshoot issues pertaining to the donning and doffing process. The indications of donning PPE are as follows. For providing care to suspected or confirmed COVID-19 patients, performing oropharyngeal or nasopharyngeal swabs on suspected COVID-19 patients, and performing aerosol-generated procedures on COVID-19 patients. Before donning, ensure to change into clinical scrubs provided by the hospital. Remove the jewelry, wristwatches, and other personal belongings before donning PPE. For males, ensure that you are clean-shaven for a proper N95 fit. The donning process requires the following equipment: alcohol-based hand rub solution, N95 respirator or surgical mask, boot cover or shoe cover or boots, head cover, isolation gown, eye protection, which could be face shield or goggles, and nitrile gloves or non-powdered latex gloves. The following are the sequences for donning process. Firstly, perform hand hygiene with the alcohol-based hand rub solution. Next, put on a pair of boots or shoe cover or wear the hospital boots provided. Wear an N95 respirator or surgical mask. If wearing an N95 respirator, ensure that the upper strap is at 45 degrees angle up and the lower strap is at a 45 degrees angle down and perform a fit check. After that, wear the hood cover. Next, wear the isolation gown and tie it securely. Then, wear a single pair of nitrile or non-powdered latex gloves above the cuffs of the isolation gown. Lastly, put on a face shield. Ensure to tear off the protective layers of the face shield before wearing it. There are a few key points to remember during the donning of PPE. An N95 respirator is worn in situations where the patient is not able to wear a mask or when there is procedures done such as swab taking, patient on oxygen therapy, and when performing an aerosol generating procedure. Every time when donning an N95 respirator, a fit check has to be performed by first adjusting the edges of the respirator and then inhaling and exhaling sharply and observing the expand and collapsibility of the respirator. Discard gloves with any other soiled PPE and perform hand hygiene in between patients. Next, we move on to the doffing of PPE. So why is doffing done? Doffing is important in order to remove all contaminated PPE to protect both the healthcare worker and the patients. Before doffing, ensure there is adequate alcohol-based hand rub solution, adequate alcohol or non-alcohol wipes, and a clinical waste bin that is not full. The following are the sequences of the doffing process. Firstly, discard the gloves. Next, perform hand rub. Then remove the face shield by holding the strap at the back and discarding it immediately. Perform hand rub. Remove the isolation gown by tearing it at the back of the neck and waist and folding it inside out neatly before discarding it. And then next you perform hand rub again. Remove the hood by holding it from inside and discarding it immediately into the bin. This is then followed by performing hand rub. Next, remove the boot or shoe covers and discard them. If wearing boots, wipe the boots from top to bottom in one direction, making sure to cover all the areas. Lastly, perform hand rub or hand wash. Key points you should remember during the doffing of PPE are: The most contaminated PPE is removed first, followed by the least contaminated PPE. The PPE that is in front and outer part is more contaminated than the back and inner part. It is essential to perform hand rub at every step during doffing. The surgical mask or N95 respirator is only removed at a clean area where a new mask is readily available and not at the doffing area. Well, we have come to the end of this topic. Thank you for your time.